sound so excited. Lindsay, do you want to come up? Yes, please. Good afternoon, everyone. I'm Mike Totoraitis. I'm the Commissioner of Health for the City of Milwaukee. I'm joined by Lindsay Page, who's the Director of Infectious Disease for the City of Milwaukee. We're here to provide some updates about the measles investigation at a flight that was at Mitchell Airport, and we'll do that and then we'll take questions. So where we are right now, there was one individual who obviously flew through the Mitchell International Airport on the 29th. We were notified last Friday and started our investigation. We learned that there were 6 individuals on the flight from the City of Milwaukee that were potentially exposed. So we have been in communication with those individuals, and there's also likely other contacts from the airplane that we do not have. Those are residents of other jurisdictions in the state and other parts of the country as well. So we're in collaboration with the CDC and other state health departments and other local health departments here in Wisconsin. As we shared on Friday, that individual who was sick on the plane transited from the airport to Walworth County and is isolating there in cooperation with the health authorities there. Right now, we're continuing to work with the airport and ensuring that their staff are made aware of what happened in the window between 10:31 p.m. on the 29th to 12:31 a.m. For potential exposure to measles. Measles can stay aerosolized in the air for up to 2 hours after an infectious person is present in that room, and we also know of cases where shared air handling can spread the virus throughout an entire building. So we want to make sure that everyone who was at the airport was safe during that time. And then lastly, we are waiting on wastewater data. As was shared on Friday, we really were excited this time around to have wastewater surveillance for measles, and it did pick up the case in Walworth. So we're really interested to see potentially if there's any detects here in the Milwaukee sewer shed, because obviously that's encompassing of the City of Milwaukee and other jurisdictions in the region. So we're in collaboration with the other southeastern local health departments as well to make sure that everybody is prepared to do contact tracing and continuing to investigate as needed. Happy to take any questions.
When do you guys expect that wastewater data to come back for Milwaukee?
In a couple days. So we're anticipating getting that hopefully later this week, if not Monday at the latest. And the interesting thing is that there'll be a signal that there's a measles detect. We can't actually see, is it the City of Milwaukee or somewhere else in the sewer shed, because we have what's called a combined sewer shed where everything dumps into the same location, so we can't isolate it to say, hey, this is in Cudahy or this is in South Milwaukee or Milwaukee. So we're anticipating to get those results in a couple days.
Could you speak to kind of how contagious measles is and how in a setting like a plane it would spread?
Yes, there's 2 schools of thought. One school is you do contact tracing for 2 rows ahead of that individual and 2 rows behind, so that it's more isolated to that individual who is infectious at the time. And then there's other studies that have shown that an entire plane can be infected, so it's really dependent on what kind of air handling and HVAC is in the plane. It was a Boeing 738. I am not an aircraft engineer, so I can't speak to how the air handling happened, but we were giving context based on the 2 rows ahead and 2 rows back. We did have another passenger of that plane reach out just looking for some guidance for us, so if you don't hear from either the CDC or a local health department, feel free to reach out to your health department to get some advice on what to do if you're on that plane, or you can talk to your provider as well.
So was this flight full? Did it have a connection elsewhere? Did it stop in Phoenix, or was it coming directly from Phoenix?
It was coming from Phoenix, and I don't have information on whether or not it was full. The way we receive the contacts and manifest information is based on that 2 row ahead, 2 row back. But what happens with a flight is that the CDC is involved and the state is involved to ensure that there's communication to Southwest and that they understand the broader implications of just what happened.
And the people that are now in quarantine, that are now in quarantine, were they vaccinated? Do you know if they were vaccinated?
Can we share that? I'm They were, yeah. What did the state share on, do you remember?
Can you go back on the question? Sorry.
So that case, what's unique about that case is it originated out of state. And through the air travel is how it got looped into Wisconsin. And we're only responsible for the cases that happen for City of Milwaukee residents. Obviously, we work across all of the different jurisdictions with our partners that have their health authority for their specific jurisdictions. And the case technically won't be counted as a Wisconsin measles case because it originated in a different state. So there's just some kind of funky recording that happens with these measles cases. So what you'll see nationally is that we have two cases here in Wisconsin, the one in Waukesha, the one in Dane County. There will not be a third recording. However, there will be a detect shared on the wastewater surveillance for this kind of situation that we're in.
You did say that there were other contacts in different jurisdictions that will be handled. Can you give us any insights as to how many people there are or anything like that?
I don't have a lot of information for that. I know that there was one in a neighboring suburb of Milwaukee, but what's fortunate about this incident specific to the cases here and potential cases in Wisconsin is that individual went directly from the flight to their home and residents in Walworth County. So the likelihood of them exposing other people is very low. Obviously, specific to the plane, there was exposure, and to the terminal, there was exposure. If you rewind back to 2023, when we had our other most recent measles case, there were over 800 people that were exposed because that person was infectious and at multiple public spaces during their infectious period.
Now, this was obviously a few weeks ago, that flight, January 29th, and we're told that these people that were on that flight should be monitoring themselves until what day again?
February 19th.
Okay.
So they want to make sure that if they start feeling ill, to certainly notify their physician. Strongly recommend that you call ahead if you want to go get tested for measles. If you are fully vaccinated, so you've had 2 doses of MMR, you will not need to worry about quarantining because you've been fully vaccinated. And we did have an individual reach out who was concerned about what was going on, but the guidance that we operate under, and this is national standards, is that if you're fully vaccinated, you don't need to quarantine. But if you are partially vaccinated or you're not vaccinated, we need you to quarantine until the 19th. And certainly if you start to develop symptoms, let your provider know right away, and then they can make a plan to safely get you tested.
So there's 6 people who you guys have been in contact with, they've all been advised to quarantine?
The majority of them have been vaccinated, so they wouldn't have to quarantine during this period.
Do you have numbers on how many are
I
quarantining?
do, but I can't share the exact numbers.
Okay, and I mean, last school year, I guess 2025 state data says only 56% of Milwaukee Public Schools kindergartners had the minimum MMR vaccination requirement. What kind of risk does even a small case count put the community at?
It's incredibly concerning. A parent that was walking their infant who's under the age of 1 through the airport terminal could have been exposed, and that child is not eligible for the vaccine. Measles is more contagious than COVID. Obviously through the pandemic, we were always saying, hey, this variant's more contagious than the last one, which really didn't mean a lot, but the measles vaccine generally can infect up to 11 to 14 additional people in an unvaccinated population versus COVID would anywhere between 2 to 6 additional people would get sick from COVID in an unvaccinated population. So that's almost a tenfold increase in people that would get sick from measles. So if you're looking at a school or a daycare where children might not be up to date or not eligible for the vaccine, that's highly concerning. And what can happen in a full-blown community outbreak setting is that the CDC advises that children 6 months and up can actually get vaccinated in an emergency situation like that. We're not saying that we're there. That would be a very clear recommendation that the state and whatever jurisdiction that was in that situation would make, and that would be a big step. But we are concerned, and I think parents who haven't gotten their kids up to date on their vaccines, call your local health department, call your provider, make a plan to get vaccinated. Go on Wisconsin Immunization Registry if you're a Wisconsin resident and check your status. Most folks who are born in the 80s and 90s, that's really when a lot of those records started entering into were. So if you're older than that, you might not see your records in there. But make a plan to get yourself up to date if you're not up to date, and ensure that you have that plan.
We're here today because someone didn't listen to medical advice
Mhm.
to isolate. For those cases in Milwaukee County, the people who aren't vaccinated, is there any sort of oversight to make sure that they do follow that advice?
Yes, so every local health jurisdiction has the authority to quarantine someone in their home, even under the guard of a local law enforcement. So here in the city of Milwaukee, if someone were refusing to quarantine, we could quarantine them to their home and place a Milwaukee police officer out front of that home. Those are very extreme cases. I would say the majority of our experience with communicable disease, we always have folks that work with us. We really try to meet people where they are with their circumstances, because obviously if we're telling you to stay home from work for 21 days with measles, that's a huge hit to your finances, being able to pay rent and groceries. So we always try to work with folks to make sure that they have a plan to weather that kind of quarantine. And in those extreme cases, we can, place a police guard on the home.
Has that happened yet?
Not in Milwaukee, no.
Can you speak to, if you get that wastewater signal, how long it would be then till someone, presents and is feeling sick? And, let's say you do get that wastewater signal in a couple days, like what will the health department be doing between then and when someone presents with illness?
Yeah, so for us, within public health, we always talk about surveillance. So surveillance means just actively looking for diseases. And wastewater is an amazing tool. Wastewater surveillance is an amazing tool that we did not have back in October of 2023. We were looking for COVID in the water, but we were not looking for measles. So this is a really unique moment that if we see that signal and we see a detection of measles viral load in the wastewater, we will then take that additional step of ensuring that all of the people that we have contact lists for are contacted, that we know where they've been, and certainly it puts additional pressure on those individuals who are not vaccinated, because that could signal that they didn't, fully disclose that, maybe they went, to a party or they went out to dinner one night and they had forgotten about that. So we're going to be calling those folks again to say, hey, are there any other places that you might have gone that you could have potentially exposed people? Because you're infectious 4 days before the rash goes over your body and 4 days after the rash. So that's a pretty wide range. And unfortunately, again, with measles, the incubation period to when you start to feel some symptoms is anywhere between 7 days after exposure to 21 days. So that's a really long time. And, if you were exposed on the 29th and now you're kind of in that period of potential symptoms developing, now we're really looking closely for these additional cases. So if we have that wastewater detect, we are going to be enhancing the contact tracing and continuing to follow up with people.
Would the health department release that publicly if you see that wastewater detect?
Yes,
Okay.
yeah.
So besides the 6 cases, possible cases that you guys are monitoring right now, are you guys also expecting more? Or are there others that are in other jurisdictions, with residents that are in other jurisdictions?
Yeah, so
Possible contacts, right? I just wanna make-
contacts,
Okay,
yeah,
okay,
not
just wanna make sure,
cases.
yeah.
There's a very
Yeah.
distinct distinction between cases and contacts. So there are no contacts that we're concerned about right now with the information that we have today. We are still doing contact tracing with the airport, and if there are significant developments that we would obviously share that, because we want folks to be aware. When we take these steps of making public notification, it's because we cannot 100% guarantee that we can get every single person that was on that flight and every single person that was present at the airport at the time. So we do these public notifications so people can have the information and make a plan if they don't have it. For City of Milwaukee residents, if you're not up to date on your vaccine, you can come to our clinics. Those are listed on our website, and get vaccinated at no cost. Doesn't matter your insurance status. We have those shots available. Yeah. Other questions?
You're an adult and maybe you can't find your records or can't access them and you're not sure if you have it. Is it hurtful to get it again?
No, it's not. It's perfectly safe. We shared that on Friday, and that's the easiest way if you can't find your records. You're not going to grow an extra ear or anything like that. You'll just be up to date. And for folks that are fully vaccinated, there's no need to get a booster or anything like that. The measles vaccine is highly effective. It's 97% effective. So there isn't any need to go out and get another booster, even if there were like a full-blown outbreak. So. Yep, you had a
For
question?
those people born before, I might be the only one here, born well before the 80s.
Yep.
Let's just say that. Where would you find your old records? Is there a place, you said that only in 1980 these days?
Yeah, do you want to?
Yeah,
Take
so
a
I'm
stab at that.
I'm checking with your primary care provider. Sometimes their offices will have records of that. That would probably be your best bet. Again, if you were unable to locate the records or, just unsure of your vaccination status, it is safe to get repeated doses of MMR vaccine.
And before the vaccine was available in the 60s, so if you were born before 1952 roughly, you likely were exposed to measles. So generally, if you're of that age, you don't have to go get vaccinated because it is assumed that you were exposed to that as a child. And many people that have had measles before know that they had measles. I had chickenpox before the vaccine was well established in the vaccine schedule, so I don't have to get vaccinated for chickenpox because I've had it. Any last questions? Yep.
Why does the Waukesha County case counted when that was an international travel?
Because that person, oh yeah, that is a good question. Do you know?
They reside in Waukesha County.
Oh, they reside in Waukesha County. And I think they became symptomatic when they were here, correct?
As far as I know, yes.
Yeah, so versus the other person, and the difference, the case that's here in Walworth County, they were sick in another state before they started traveling. So that gets counted in that state where they flew out of.
Could you just kind of speak to how measles impacts maybe the average person and maybe someone who's immunocompromised?
Yeah, I mean, the worst case scenario is that the person dies. It elicits a really intense immune response, and for children that can't be vaccinated or those who have immune systems that are compromised, they could die. And as a parent of young children, when they were younger and there was measles outbreaks around the country, I was very nervous. And at the time, if folks remember, there was an outbreak of measles in Chicago. And that's a car ride away from being transferred up here into Wisconsin. And, as we see with airplane travel, it can travel around the country really easily. So I, as a parent, really take the time to make sure I understand the vaccine schedule and that my kids are up to date, because I want to give them the best chance to avoid getting sick and then prevent them from having really adverse outcomes, and in this case, death.
Thanks, everybody.
Quick question on the wastewater really quick.
Yeah.
Does that detect like one